Welcome to Pennsylvania in Focus. I'm Eliana Kernodle. Joining me today is the Center Square's Pennsylvania editor, Kristen Smith. Kristen, how's it going?
Good. How are you?
Doing well. Today we're talking about legislation in Pennsylvania to ban transgender surgeries for minors. Can you tell us more about this legislation?
Yes, the bill that's been proposed is called Do No Harm. And this is interesting because it's named after a medical advocacy group that is made up of physicians primarily that are disturbed by the overall pediatric community's embrace of medical treatments for minors experiencing gender dysphoria. Their feeling is that these patients are far too young to be undergoing treatment and taking, hormonal blockers and getting surgeries that would align with the gender that they feel that they are, and that it's causing irreversible damage. It's harming bone health and going far beyond just treating the gender dysphoria that they feel. And so Do No Harm has done a lot of advocacy. They have been in Pennsylvania promoting their database that looks more deeply into this issue through insurance records. And they've really pushed for legislation, not only in this state, but in other states, to make sure that going forward, there will be no legality for these treatments for minors.
And this bill isn't necessarily new. It's been around for a little while, but they're kind of working on talking about it more, getting more people involved in the conversation, right?
Yes, it's very new in the legislative process. It was first discussed and the circulation memo was sent around in December, and it has yet to be formally introduced. So there's no specific bill number for it yet. However, the Senate Majority Policy Committee will be holding a hearing on it next week on April 15th to discuss the issue further. It's likely to be very controversial, although it will have a lot of support in the Republican-controlled Senate. Will it make it for a vote in the Democratic-controlled House? Probably not, although that's a very narrow margin. And when it comes to issues regarding transgender policies, where there seems to be a more bipartisan feeling is when you start talking about this specific issue, surgery and medication for minors. There is a pretty pervasive feeling that this is going a step too far, and that Do No Harm is, their support is broader than, say, people who feel that transgender women should not be in women's sports. So, it remains to be seen that perhaps this is not as much of a Republican versus Democrat issue. There could be bipartisan support, although because of how difficult this subject is at a state level, I don't know that even if this is, or when this is introduced, let's say, that it will have many legs, that it'll get all the way to Shapiro's desk and what he'll have to say about it, quite frankly.
You mentioned Do No Harm's database. They're kind of promoting this. They've got different information on it, but there's sort of competing sets of information when it comes to how pervasive these treatments are. Can you kind of unpack that for us?
Certainly. So Do No Harm is looking at insurance coverage claims for gender dysphoria treatments. Primarily, they're looking at breast reduction surgery because that is something that in insurance coding is easier to track. And that is something that medical providers would, that is a treatment that would be more commonly prescribed. And Do No Harm is saying that according to their data that they've collected through their database, insurance companies have covered 558 claims for puberty blockers and 321 surgeries for more than 800 minors in Pennsylvania. Of the latter, Medicaid approved about 125 of those, and commercial companies handled the rest. So, 800 minors, we have 13 million people in Pennsylvania. There It is a small factor it's a small group of minors, let's just say. As far as dollars that we're talking about, we have 5.9 million submitted hospital claims, 469,000 for puberty blockers, 2.9 million from private insurers, and 2.5 million for managed Medicaid. And these also cover surgeries as well. Nationally, you're looking at a database that includes 14,000 minors, and that's at a cost of $119 million. So there is money tied up in this. And 14,000 is a small number relatively, compared to the amount of minors that are in this country. But it is a growing concern as far as parental rights goes, and as far as what advocates aligned with Do No Harm say is as far they want to classify it as abuse, that they feel that this is absolutely going too far, it's inappropriate, and that the medical community needs to step in, and that legislators should step in and find a way to stop this. That's their moral imperative. On the other side, there is a moral imperative from the medical community that is supportive of these treatments for minors. They're saying that it helps reduce self-harm among transgender youth, and that the vast majority of surgeries that are paid for, particularly by insurance, again, for breast reductions, are for cisgender males, which is just boys who identify as boys and are not trans. And that there are reasons for children to get puberty blockers and other gender affirming treatments that have nothing to do with being transgender, so that they feel that the numbers are a little bit misleading in that case. And so there is, and then more broadly, the medical community is saying that this is an issue that treating minors for can help prevent adverse effects down the line, from a mental perspective, particularly. So there is very strongly competing visions on either side of this issue. Under a new Trump administration, it's unlikely that the support for more gender affirming care, as supporters call it, there's going to not be as much widespread support. Will there be changes to Medicare about how these things are covered? It's possible. The Trump administration has already decided not to cover weight loss injections, that these Wegovys and Zepbound and the other diabetic medications that are being used for weight loss. So is something more controversial like surgery and medication for transgender minors, is that something else that's going to be on the chopping block? We'll have to see.
Well, Kristen, thank you for your insights on this story. You can continue to follow this story at thecentersquare.com.